In this video, I want to talk about the differences between Invisalign and the direct-to-consumer clear aligner systems such as Smile Love, Pure Smiles, Smile Direct Club, Straight Teeth Direct, Candid Co, and possibly others. It seems like there's been a lot of direct-to-consumer companies advertising very aggressively, and many of my patients have asked, what are the differences between Invisalign and these other systems? I've looked into it myself. I've kind of acted as if I was a consumer and researched it as best as I could, and sure enough, there's definitely a bit of a lack of information on the technical differences between Invisalign and these systems, and it's important to understand these technical differences because they can make a very significant difference in terms of the quality of the end result based on your case. There's three differences in particular that I want to mention. Difference number one is being able to see a dentist or a dental professional firsthand and having them be able to look in your mouth and be able to evaluate your teeth that much more closely. There are so many times where maybe based on photos, I may want to treat a person a particular way, but once I look in their mouth and be able to analyze how their teeth fit together, how their bite is, how their teeth rub against each other, it really changes my treatment plan. And I'd love to say that from start to finish, things move perfectly smoothly in every single case, but many times there are instances where as we have, we've decided to move along a certain path, and as long as we're going along the path and we realize there's a bit of a pothole, and the pothole could be the bite being affected, or an interference, one tooth hitting another tooth a little too hard. And many times we have to reevaluate how we want to move those teeth, and we end up with Invisalign rescanning and creating a new path of how to proceed. And I wish I could just perfectly program it from start to finish. The real life result would be perfect like the virtual result, the virtual world result that we are predicting it to be, but it's not. And that's why it's really important to be able to see a professional on a bit of a regular basis and having them to reevaluate their treatment to make sure it's going like we want it to and making sure we achieve the result that we had planned on. The second very significant difference is really Invisalign itself. Invisalign's been around for about 20 years. Some of their old patents have now expired, and that's what's led to a lot of this competition. But over the last 20 years, Invisalign has improved dramatically as a company. I've been doing Invisalign myself for 13 years, and over the last 13 years, I've seen a huge improvement in Invisalign, and from a perspective of its predictability of treatment, as well as its comfort of treatment. Many of the reasons why are because it's completely vertically integrated. They make their own scanner, they make their own plastics, they make their own hardware, they make their own trays, and they make their own software to do it. And they spend an enormous amount of research and development funds every year on this. And their new plastic is significantly better than what they used a few years ago. The way they cut their trays along the gums has made it, in my opinion, a lot more comfortable. And a lot of these new innovations is something that Invisalign has and these other companies do not have, because these are patented innovations that these other companies won't be able to have access to for perhaps decades. And the last significant difference between Invisalign and those direct consumer systems is attachments. And I really think this is probably the biggest difference between the systems in terms of what it means in terms of the quality of the end result. When you think about it, our teeth are roundish and they're in a slippery environment, and we're trying to move them with a plastic tray. And so if you think about it, like if you move teeth, if you push them a certain way, they will move a certain way. But certain movements, like let's say rotating a roundish tooth, that is very difficult to do when you're moving it in a slippery environment with a piece of plastic. If you think about the physics behind the movement, you need to be able to grab onto those teeth. And that's what attachments are, and that's what Invisalign has. These are literally white filling bumps that we specifically are designed to move a tooth a particular way. And if you see from these images, there are a variety of different shapes, and that's based on the differences of the physics involved in the forces involved in these movements. So as we want to move a tooth up or down, or if we want to move a tooth sideways and close a space, we don't want to just tilt a tooth, we want to move a tooth straight. We call it bodily movement. We need to move that root. How do we do that? Well, we need those little bumps on the teeth to be able to apply the force against the teeth in a certain way to be able to achieve that predictable movement. And when treatment is done at home and you're just changing a plastic tray, a lot of these movements I just would not be able to achieve without attachments. If one of my patients asked me, for instance, Dr. Dhillon, I'd like for you to treat me with Invisalign, but please do it with no attachments at all, it literally would be like tying my hands behind my back. I just would not be able to achieve nearly as good of a result as I would be able to achieve with attachments. You're probably wondering, who are they, would they be best for? And now Invisalign, because of its capability, is pretty much is good from anyone from very mild corrections to very advanced complex cases. Whereas these direct-to-consumer systems, with their limitations, would be best for people with very mild problems or very mild corrections, where perhaps certain teeth just need to be tipped in such a way that an attachment wouldn't be necessary. The good news is that we offer Invisalign at multi-levels of treatment, from mild cases to very complex cases. And as a result, based on the complexity, we have different price range. And we have many levels of price that are comparable to these direct-to-consumer systems, but yet having those advantages, those three differences we talked about. So come visit us and see us for a free, no obligation orthodontic consultation, and we can talk about how Invisalign might be able to improve your smile.